Humankind is produced in association with WGBH Boston and supported by the Humankind Program Fund and a grant from the Henry Luce Foundation.
The whole discussion of what effect the mind has on the body in many ways is sort of a misnomer, because it comes from an assumption that the mind and the body actually operate separately.
The mysterious placebo effect. What we can learn from the medical fact that fake medicines sometimes actually work. You're listening to Humankind. I'm David Freudberg. How is it that when scientists are researching the effectiveness of a new medication, the health of some patients improves measurably, even when they've only taken a placebo, maybe just a sugar pill that contains no actual medical ingredient? Accounting for this placebo response is a scientific principle in almost all drug testing and makes it hard for the developers to pinpoint how well their medicine really works. The reason is that our expectations of a drug are formed in the human mind, and the mind-body connection is enormously powerful. Physician and best-selling author Andrew Weil says that researchers have studied many examples of mind-body interactions.
One that goes back really forever is the demonstration that hypnosis can produce very dramatic changes in physiological functioning. For example, you can take a person in a deep trance, touch them with your finger and represent that as a piece of hot metal, and they'll get a blister at the site. I mean, that's all you need. You just need one example of that to show you that it's possible for a thought or belief to go directly into the physical body and produce a real physical effect.
One explanation is that immune cells in our body have receptors on them for neurotransmitters. These allow nerve cells to communicate with each other, a chemical conversation between the brain and our immune system. So our thoughts and emotions send signals that affect the functioning of our body. When scientists test a new medication, a constant question mark is whether the effects on a patient are attributable to the drug itself or to the placebo response. So our mental perceptions about the drug matter. If we believe it can heal us, chances are better that it will. These expectations reflect our understanding of the drug treatment, what it means to us, and that can sway our health. Wayne Jonas, a family physician, directed the Integrative Medicine Center at the National Institutes of Health.
One of the big dilemmas in medical science that is constantly trying to be sorted out is how much of a healing response is due to the actual treatment and how much is due to this meaning and context effect. Even proven therapies, surgical therapies or drug therapies, a large part of how and why people get better is due to this meaning and context effect. And so disentangling those is important in science to try to tell how much is due to a particular therapy. But when you get into practice, you want to optimize both of those because you're trying to improve the patient to the maximum degree. So you actually want to use the placebo effect. I don't like that term. I prefer to call it the meaning effect in order to induce healing. And with that, you could then use any kind of an agent. You could use a needle. You can use a knife, as in surgery. You can use a pill. You can use an herb. Or you can use a drug. Whether those latter components actually produce or add anything to the effect is part of what medical science tries to sort out.
And so you're saying that the primary agent in healing is the meaning effect, and these other interventions might add to the meaning effect?
That's absolutely right. And in fact, the meaning effect produces most of the response that you see in actual clinical practice or that you see in your life. It varies by the treatment, of course, but on average, particular drugs, even proven ones, for example, only add about 20 to 30% of the effect of the response. The rest, the 70 to 80%, comes from our own inherent healing capacity and the fact that it's induced and it is responding to the interaction and the intervention that goes on in the clinical context.
Are there particular ailments that are especially sensitive to the meaning effect?
Yeah, absolutely. Things that are more subjective, for example, pain, responds robustly to the meaning effect. But a lot of other physiological processes also seem to be responding to it, and medical science is just beginning to explore how broad this effect is. For example, there's good research showing that even Parkinson's disease responds to this, and inflammatory processes and immune responses can also respond to this. So we know, for example, that subjective things like mood and pain respond very robustly to it. But it could be that other more physical and more objective things respond if we investigate those in more detail. So that's one of the cutting-edge areas for examining the capacity, the depth, and the breadth of the meaning response.
Researchers have observed that patients suffering from gastric ulcers heal better when they're prescribed 4 sugar pills a day compared with people who take 2 sugar pills, yet there's no genuine medicine in any of those pills. Patients exhibit improved healing response to bigger pills and to specific colors of pills and to those in shiny packaging rather than plain containers. A widely recognized brand name tends to heal more effectively than unbranded pills with the same ingredients. And of course, direct-to-consumer advertising for drugs is ubiquitous and is designed to shape our perceptions.
Don't drive or operate machinery until you feel fully awake. Walking, eating, driving, or engaging in other activities while asleep without remembering it the next day have been reported.
And apart from marketing itself, other commercial factors influence whether a patient has a healing response from taking medication.
You can also manipulate this effect by cost. In many countries, the U.S. is one of them, we often believe that more expensive drugs are more effective, and there's been good studies showing that if you raise the price on a treatment, you're going to see a greater proportion of effect in people than if you have a lower price, up to a limit. If they don't believe you, if it's so expensive they don't actually believe that the effect is there, then it'll start losing its effect.
So you're saying if people pay more for a particular pill, it will have greater effectiveness in relieving their physical pain?
That's correct, up to a limit, as I said. If it's an exorbitant price, then they stop believing that it's real.
Well, then the source of the pain could be the price.
Exactly right.
In addition to his duties as a practicing physician, Wayne Jonas now directs the Samueli Institute, a medical research center outside Washington. They study a range of non-pharmacological healthcare options, including nutrition, meditation, yoga, herbal medicine, and biofeedback, a technique that helps patients monitor their own physiological functions. Of particular interest to Dr. Jonas is understanding the role of a patient's expectations about medical treatment and how that affects health outcomes.
It gets back to the way we construct meaning. For example, they've shown that in the West, where shots are thought to be more powerful than pills, if you give a inert substance, a placebo, for pain, for example, by shot, the patients are going to report much better relief than if you give it by a pill.
Even though the injection contained no healing substance?
Yes, right. The injection is a salt water or something like that, and the pill is sugar pill. There's no active ingredient in either of them. And so the meaning is what's producing the effect. Likewise, if you give a painkiller in a hospital, or some authoritative physician in a white coat who you believe in gives it, versus someone just comes to your home and gives it, or you take it yourself at home, you're going to experience greater pain relief.
Are these inert substances being injected or being dispensed as pills without the knowledge of the patient?
Well, it used to be physicians gave out placebos or inert substances all the time. I can remember in my early training over 30 years ago that the hospital that I trained in actually had a pill that you could prescribe called Oldacap, which was the word placebo written backwards. And if you wrote Oldacap, the pharmacy would dispense a sugar pill. Now that is considered unethical now, and in fact, in my opinion, lying and deception is unethical, and it should never be done. That kind of behavior that I described from 30 years ago is now gone out of favor, and you don't see it. But what happens is that physicians start to use things that the evidence shows do not work, but they might have an effect. For example, an antibiotic for a viral infection. We know that antibiotics don't work for viral infections, and yet in the time pressure of a clinical visit with a desperate patient who's sick, physicians will often prescribe an antibiotic, even though they know it probably is only acting like a placebo.
So in the old days, when doctors would, with a straight face, prescribe a month's supply of Oldacap to some patient in distress, why were they doing so? What effect were they anticipating?
Well, I think physicians were attempting to optimize the mind-body effect. They may not have called it that. In some cases, they may have just been trying to get the patient out of the clinic because they had a big line. But I think most caring doctors who did this believed that if the patient believed, or they knew that if the patient believed in a treatment, that it was more likely to have an effect. And if they didn't have a specific treatment for the condition, like a viral infection or like a chronic fatigue or something, and there was no scientifically based, evidence-based treatment for it, they would often feel like it was better to give something and try to help give the patient some relief than to tell them there was nothing they could do and have the patient continue to suffer. I think that was the underlying motivation for most physicians who want to be healers.
And did, in fact, the prescription of these placebo pills prove to be medically beneficial?
They probably were, again, depending upon how they were given. If they were given in a way that induced a deep meaning response, then they probably had an effect. If the doctor was kind and empathetic, if they gave it with authority, if the patient believed in it, if the physician believed it was going to help, if those things all aligned up, then the evidence now shows that the likelihood is that you could optimize this meaning response and the patient probably did improve.
Can you describe any specific incidents, obviously without compromising the confidentiality of a patient?
Recently, I had a man that came in who had depression. He was a military, a veteran with PTSD. He'd had a traumatic brain injury. He had chronic pain syndrome along with those other things. He was on about 15 different medications. And most of what he had been receiving was some behavioral therapy, which was helping him, but mostly manipulation of the different kinds of drugs. He was getting side effects from the drugs. They were helping him some, but again, not to a huge degree. So we did a deep exploration of his own well-being. What did he do to help heal himself or help feel better in those areas? As it turned out, he was very religious, and he prayed, he went to church, and he said that when he was praying and when he was in church, this actually was the best time in his life. He had less symptoms, less pain, his mood was elevated, he felt better. And so here was a way that he was using the social context and probably the relaxation response through prayer to help induce his own healing response. So we took that, and I worked with him to try to enhance that effect, to make it deeper, to give it more meaning. And so we explored with him methods to do that, and he was a sort of like technology and like biofeedback and video games and things like that. So we used a heart rate biofeedback approach to enhance and deepen his relaxation response when he engaged in prayer. And after doing that for several weeks, he found that he was able to tap in to this mind-body effect much more effectively and, in fact, enhance his mood on a longer-term basis, reduce his pain on a longer-term basis, and reduce the medications that he was on and function better.
Might there be an element of his spiritual faith that produced a therapeutic effect?
Well, I think absolutely, and because there is extensive work looking at the role of faith, the role of belief, the role of religious belief in this case, and the role of sort of spiritual experiences, deep spiritual experiences in terms of healing. And so it's possible that in addition to the relaxation response that he was likely getting from his prayer and the interaction at church, his own enhanced belief, which we know is a component of the meaning response, could be made more potent by faith and a belief in God.
We're talking with physician Wayne Jonas, president of the Samueli Institute outside Washington. It studies natural, non-pharmacologic healthcare techniques. He previously directed the Center on Integrative Medicine at the National Institutes of Health. You're listening to Humankind. I'm David Freudberg. For more information on this segment about the placebo effect and to obtain an audio download, you can visit humanmedia.org. The placebo effect has been shown to cause measurable physiological changes in patients. For example, a placebo painkiller can trigger the brain to release pain-relieving chemicals. One recent study in placebo research found that even when patients are told explicitly that the pill they're asked to take has no medicinal ingredient, it's more effective at relieving symptoms than doing nothing. In that study, the word placebo was actually printed on the bottle, yet somehow it promoted healing. Dr. Jonas.
Those studies that actually inform the patient that they're getting an inert treatment and then go through the same ritual of creating a deep meaning effect and showing that illustrate exactly what I'm talking about, that it's the meaning effect that is producing the effect and not the pill. I think one of the things that is important to clarify here is that the meaning effect is not simply your cognitive belief, what you think is going on. It's deeper than that. It's based on your experiences from the past. It's based on the social context and expectancy that's been created. It is a conditioned response that you learn over years, and so it can be induced by even unconscious processes if the right ritual and the right framing and the right delivery is made. And telling a person, the studies where they've told a person that they're giving them an inert substance or a placebo and that they still get a response illustrates that the cognitive or the conscious expectancy or belief is only one part and maybe even a small part of the meaning response and meaning effect.
It may be that medical science does not yet fully understand the mystery of placebos, and healthcare providers are not advising patients to avoid needed medical treatment or drugs. But according to Dr. Wayne Jonas, some conditions are especially responsive to the role of belief and expectations that shape how a patient responds to treatment.
Certainly the chronic pain conditions that we've just been talking about, many mood and mental health issues like depression, very prevalent. Obesity is an example. It's very prevalent and growing right now. It's a chronic multifactorial illness. Arthritis are conditions that we live with over long periods of time, and there's no magic bullet for them because there's multiple factors that contribute to them. These kinds of conditions, which are growing and getting more prevalent as our population ages, because older populations tend to have multiple chronic conditions. These are the kinds of conditions that we don't have a magic bullet for. We don't have a particular drug or treatment that can, remove it. And so we still try to apply the drugs to those areas and try to apply the specific treatments, but the degree of effect that we're getting from those is fairly small, and often the side effects are pretty widespread. And so we're getting diminishing returns. It used to be that if you found a specific treatment for a specific condition, let's say an antibiotic for pneumonia, where you knew that a bacteria was causing the pneumonia and the antibiotic was going to kill that bacteria, then you'd see dramatic effects from that. That's an acute condition, for example, or there's a condition where you know exactly what the cause is, and if you eliminate the cause, you see dramatic responses. That works really great for those types of conditions, but when a chronic illness with multiple etiologies or multiple causes is being manifest, then it doesn't work very well, and in fact it can backfire and produce side effects that you don't want while only producing small benefit.
And one of the rather hazardous side effects can be addiction to certain medicines, especially for use in pain relief. This is a massive problem in the United States. Might the use of placebos provide an effective alternative to these addictive drugs?
Well, this is a huge problem. Pain, especially in the use of opioids, for example, which are very addictive, and their use for chronic pain and has now been rampant and in fact has led to a lot of the addiction that is going on in the country. So we clearly need to control this. We're flooded with painkillers, including opioid use in those areas. They are effective on an acute basis, for acute pain, but they, have negative consequences when used over a long period of time. So the question is, could we come up with less addictive approaches, and especially ones that induce this meaning response through mind-body practices, for example, that might substitute for this? And the answer is yes. The institute I run, Samueli Institute, does reviews of the literature and evaluation and analyses of the literature for non-pharmacological and integrative approaches to a variety of conditions, and we've recently done extensive evaluation of non-pharmacological and self-care approaches for pain, and shown that there's actually good evidence out there for a number of those. For example, yoga, acupuncture, Tai Chi, and music therapy all have good research showing that these can be used to control chronic pain effectively if they're delivered appropriately. And those kinds of practices need to be brought into the management of pain so that we can reduce the use of opioids and pharmacological approaches and still relieve the pain of patients.
I've always been fascinated by the placebo effect because it suggests that the mind has a certain capacity to heal the body itself. What does this tell us about the broader mystery of mind-body interactions?
Well, I think we are just beginning to probe the depth and the breadth of what kind of an effect the mind can have on the body. The whole discussion of what effect the mind has on the body in many ways is sort of a misnomer also, because it comes from an assumption that the mind and the body actually operate separately.
Hippocrates taught us otherwise.
He sure did. And
in ancient Greece, Hippocrates, generally regarded as the father of Western medicine, stated mind and body cannot be considered one from another, that they're the same.
They're actually the same, right?
Entity, and what a mind-blowing principle that is.
It's only mind-blowing because we've forgotten it, actually, David. he was absolutely right. And if we'd held on to those principles, I think we'd have a better system today. In fact, if you go back and look at the ancient Hippocratic school, if you go back to where that was taught and delivered in Epidurus in Greece, it's fascinating. They had within that medical center, that medical school, the ancient medical school, they had spiritual practices from the oracle. They had gardening and food that patients participated in. They worked out their social stress and social, relationship issues through drama. They had a theater there. And we now know that, for example, social relationships, social coherence, social isolation have a huge effect on chronic illnesses, including chronic pain and mood and depression, and even the ability to treat obesity and diabetes. The social component is huge. Those were all embedded in the ancient Hippocratic school, and we've sort of forgotten those in our march to try to find the magic bullet and pay for the magic bullet.
But of course, we pay for the magic bullet sometimes in extreme side effects as well.
Yes, absolutely. The evidence on this with medications is clear. Even a proven medication that, for example, might get a fairly large effect, like a 30 or 40% effect, that's only in about 30 or 40% of the population will it have the beneficial effects. Often it will produce side effects, some minor, some major, in 60 to 70% of patients, many of whom are not getting benefits. So we're also producing illness and producing disease as well as treating it.
We know that placebos can produce quantifiable changes in how our body functions just through our mental activity. It's similar to what happens when you watch a chase scene in a movie that makes your chest pound. Your heart rate is really accelerated, even though you were merely responding to a thought. In that case, the emotional meaning we took from watching an image on a screen.
If we understood how meaning was constructed, and we could put together the different lines of evidence that we're now getting from not only studies on placebo, like we've been talking about, but also studies of imagery, of biofeedback, of meditation and mindfulness, these are probably the most promising areas to move forward, because they impact multiple illnesses. They impact our health in general and disease in general. They mitigate stress, and we know stress contributes to the production of many illnesses.
Dr. Wayne Jonas, president of the Samueli Institute near Washington and former director of the Integrative Medicine Center at the National Institutes of Health. You're listening to Humankind. I'm David Freudberg. Studio recording by Doug Sugarts and Alex Curley. Editorial assistance from Ken Rogers, David Cruz, Kathy Graham, Mark Kilstein, and Bond Collard. Webmaster Brian K. Johnson. Special thanks to Tony Buck. Our program is presented by Human Media in association with Connie Goldman Productions. Program development provided by Shart Media.
To purchase a CD copy of this program, please call 1-800-5LISTEN. That's 1-800-5LISTEN. Or visit our website, where you can also obtain an audio download of this and our other programs and can hear selected episodes free. You can access free written materials related to this program as well. Our web address is humanmedia.org. Again, if you'd like to purchase a CD copy of Humankind by phone, please call 1-800-5LISTEN, and our web address is humanmedia.org.
This segment on the placebo effect is Humankind program number 239.
The executive producer is David Freudberg. This is Humankind.